Hello everyone, I am Snehal Sawant, Executive Editor of Eyezone magazine, and I am here for a special interview session on low vision services, which is part of a series of interviews and webinars of Eyezone magazine to bring awareness and address low vision rehabilitation and practices. In a few moments from now, I'm going to introduce to you our special guest who will share with us some valuable information on low vision services and practical aid for people with low vision conditions and visual impairment. Today, it's my pleasure to introduce to you our special guest, Dr. Ithar Beshtawi, Assistant Professor in Optometry and Head of the Optometry Department and Low Vision Clinic at An-Najah National University in Palestine. Hello, Dr. Ithar. Welcome. How are you doing today?
Hello, I'm really good. Thank you. And thank you for the invite.
You're most welcome, Dr. Ithar. We are happy to have you here and looking forward to hearing all the insightful things from you. Dr. Ithar, you're here today to talk about what we need to know about low vision and to better understand it and its implications, as well as give patients some ideas on treatment and rehabilitation procedures. But first, could you briefly tell us what low vision is and what are the leading causes of low vision? Also, what are the common eye disorders associated with low vision?
Okay, so at first, let's clarify what is meant by low vision. So we define a person that having low vision, that when he or she is corrected for optimum refraction and is not adequate for their needs. Regarding the causes of low vision, actually anyone can be affected by low vision because it results from a variety of conditions or injuries which can be inherited or acquired. However, eye diseases that are more common in persons who are over 50 years of age are more susceptible to have low vision. But to give some examples of low vision causes, I can mention macular degeneration, cataract, glaucoma, uncorrected refractive error, diabetic retinopathy, retinitis pigmentosa, albinism, or an eye injuries.
Thank you. We would like to know, how is low vision distinct from blindness? What kinds of vision problems can be treated? And what are low vision aids?
Okay, so as we mentioned, low vision is the loss of sight that it is not correctable when the prescription of eyeglasses or contact lenses is given or by surgeries. In low vision, there is still some sight, and it can sometimes be improved with the use of visual aids. While blindness is severely sight impairment, which could extend to no light perceptions. According to the problems which can be treated, actually, low vision includes different degrees of sight loss, from blind spots, poor night vision, and the problems with the glare. The most common types that we can see are such as loss of central vision, that when there is a blind spot in the center of one's vision. There also might have loss of peripheral or side vision, which is the inability to see anything to either side, above or below eye level, while the central vision is still intact. Or they can have night blindness, which is the inability to see in poorly lit areas, such as theaters, as well as outside at night. They could also have a blurred vision, where the objects both at near or far appear to be out of focus, and they could have hazy vision, where the entire field of vision appears to be covered with a film or a glare. There are lots actually options of low vision aids, which is any piece of equipment used by people with low vision to enhance their vision. They could be optical or electronic devices which use magnifying lenses to make objects look larger and easier to see, such as telescopic glasses, hand magnifiers, stand magnifiers, or magnifying glasses. And we also have the non-optical options, such as watches, timers, and devices with audible announcements, large print books, newspapers, or magazines, audible books, telephone watches, and remote controls with large size numbers and high contrast colors.
Thank you. You've explained some of the symptoms to us, but we would also like to know if there are any more symptoms and what are the diagnosis and available treatment. Could you also elaborate the common procedures in a low vision examination?
Actually, the common difficulties or symptoms that could be reported includes difficulties in reading, writing, seeing the boards in front of a school classroom, using computers, maybe difficulties in watching television, cooking, recognizing faces, shopping, or even driving a car. But actually, the visual symptoms the patient may report depends on the pattern of vision and vision loss. So, for example, patients with age-related macular degeneration have a central vision loss, and they will report difficulties when they look directly at something, such as in reading or recognizing faces. While patients with glaucoma or retinitis pigmentosa often have defects in the peripheral vision, and they may report difficulties in driving and mobility. People who have conditions that affect the contrast sensitivity, they will report difficulties in the ability to distinguish between objects of similar tones, like maybe milk in a white cup, or difficulties in distinguishing facial features, in addition to difficulties in mobility and reading. And patients who have conditions like vision loss in one eye, or damage to the brain that affect the depth perception, which is the ability to judge the position of the objects in the space, they will report problems in judging the depth, such as height of a step or reaching for a cup. The common procedures of examination, actually, the first step is observation. Observing the patients. Are they entering the practice room with support or unaided? It is also important to take a detailed history and symptoms, not only focusing on the medical and ophthalmic history, but also in whether the patient is living alone or with a family. Are they living in a flat with lifts or a house with the stairs? All this is really important for us in order to build a picture of that patient. Also, the ability to perform essential tasks should also be investigated. How the patient is coping with essential correspondence, are they able to do the hobby they enjoy? And maybe with additional questions to distinguish the functional disabilities to identify where the patient need extra help. Then the ocular measurements will start by assessing the visual acuity or how well the patient sees the letters that are up close or far away. In addition to the reading acuity, using real-world tasks such as a newspaper or magazine or box, school books, to take an idea of what they can manage in their everyday life, and also in order to work out the needed magnification for this patient. Contrast sensitivity will be then measured as our visual interaction with the world involves the ability to resolve how contrast details, especially in patients who report symptoms and difficulties more than the visual acuity suggested. Other tests include refractive error assessment, color vision assessment, and visual field assessment, which is how well the patient can see things in the center and at the edges of their vision. Regarding the management, at first we need to find out if the condition causing low vision can be treated or not, because some side disorders, such as diabetic retinopathy, can be treated to restore or maintain vision. But when this is not possible, low vision is permanent and visual aids, either optical or non-optical, could be helpful in this case. Thus, new glasses, magnifiers, or electronic devices may be offered, and a training on how to use them will be given to the patient, or advices on bringing the object closer to the patient, or maybe making the object larger, such as larger size box or larger TV screens. Additionally, advices will be given to the patient to learn how other ways or new ways to use their remaining vision, or new strategies to complete everyday tasks and maintain their quality of life. And finally, depending on the patient case, some patients need to be connected to additional services such as orientation and mobility specialists who will help the patient to identify the adjustment they need to make to maximize a safe and independent travel.
Thank you. Is there any specific time or when exactly should a patient be referred for low vision rehabilitation? And what exactly should a patient be prepared for when going in for a low vision test?
So when the patient is found out to have a vision which is not going to be corrected by medical or surgical treatment or conventional eyeglasses, and their vision affect their usual activities, they will be referred to low vision rehabilitations, where their vision and needs will be assessed and addressed. And the suitable optical or non-optical low vision device will be offered to them, of course, with the training. Actually, the test is simple and it's painless. They don't need to bring anything, but maybe if they bring their reading material they want to be able to read, or any previously low vision aid they used would be preferred.
Okay. And at what age is low vision rehabilitation intervention appropriate for children?
So initially, it is important to identify the conditions that are treatable. But once vision impairment is confirmed, children who are less than 3 years old can be directed to early intervention and occupational therapy services. And for older children who goes to school, they may need vision enhancing devices, changes to the classroom teaching, to modifying to fit their needs. These resources can help children succeed in the classroom and promote their independence and learning.
Okay. On low vision rehabilitation, are there any newly developed approaches in providing low vision rehabilitation services with safer protocols?
Actually, there are many new electronic devices available now, either on in portable or disk formats, such as the video magnifiers or CCTV, which alters magnification, brightness, and contrast as the patient wishes. Additionally, smartphones, tablets, and computers are widely available now, which can read aloud, magnify, or illuminate what is on the screen, and can be used, of course, by the low vision patients to address their needs.
Okay. Do optometrists who offer vision rehabilitation services consider additional accommodations for people with visual disability?
So, actually, for low vision patients, the challenge of navigating an unfamiliar office can be a source of anxiety. This stress can be eliminated by modifying the design of the office in terms of colors, contrast, lighting, and space. So, for instance, it's a good idea to put high contrast printing on the building entrance if it is made of glass, so it's easier to tell whether they are open or closed. The stairs should have a handrail, be well illuminated, and have minimal glare. Contrasting strip on the leading edge of each step would be also very helpful to low vision patients. And for the reception area, good illumination is highly needed, and strong contrasting colors for the wall and furniture are advisable, but distracting patterns should be avoided. The optometrist also should provide a clear path from the reception area to the examination room, and they need to give the patient clear instructions on how to reach the exam chair. In addition, one of the practical steps that we can take to adapt routine eye examination for low vision patients is to have the appropriate low vision charts, especially when measuring visual acuity is less than 6/60, either at distance or at near, because they have larger letter sizes.
Dr. Ithar, it has been more than a year since the coronavirus attacked humanity. We are living with it for a year now. What do you think is the impact of this COVID-19 pandemic on people living with visual disability?
So, as you know, during this pandemic, the lockdown policy that is adopted by most of the world could limit the low vision patients' access to healthcare and personal assistance to support the activities of daily living. This disruption of support system and assistance to this group of individuals may have a serious impact on their health and well-being, daily living activities, socio-economic livelihood, and may subsequently compromise on the quality of life.
Right. So the combination of being site isolated and socially isolated may have negative mental effects due to COVID-19. Are there any coping mechanisms you can recommend to people with visual disability?
So, speaking generally, the emotional impact that sight loss has is devastating and needs to be taken into consideration. And during the COVID-19, social distancing policy has been adopted by most countries in the world, which could exaggerate this problem. So families who have individuals with visual impairment persons need to participate and should not isolate themselves. Continued involvement with social and school activities, even if it is online based, are very important. Going out for a walk with the family, of course, taking into account the safety or the safety measures would be very helpful. And additionally, they may benefit from telehealth consultations to improve awareness, knowledge, and the training to any of the family members or caregivers.
Right. Thank you so much for that. It will be really helpful for people.
Yeah.
What is your overall assessment of low vision awareness in the region?
So actually, blindness and poor vision remain a growing health challenge in most Eastern Mediterranean region countries. Actually, there are a good number of studies on the prevalence and causes of visual impairment in the region, where they found out that the most common causes of visual impairment are cataract and uncorrected refractive error. And these two conditions are preventable through proper correction. So maybe more attention needs to given to correcting these two conditions. I'm not aware if there is any available charity centers for people with visual impairment in the region, as the ones available in UK and Europe. These centers are very helpful to support people with visual impairment through the examination, providing information about their eye conditions and treatment. They also give advices about work and daily living, liaise with the ophthalmologist, optometrist, and other eye care practitioners. And they, most importantly, they provide emotional support and advices to the low vision patients. So actually, it's a good idea to have such centers in the Middle East to support the people with visual impairment.
Right. Thank you. That brings us towards the end of our discussion today. But before we end, I would like to know, do you have any additional message for low vision patients out there?
Yes, sure. I want to tell them, do not be ashamed or embarrassed to have a condition which led to have low vision. You are strong, you are capable to learn and do whatever you like. We care about you and you are here to support you. Be confident.
Great. Thank you, Dr. Ithar. That was a very positive and encouraging note for low vision patients, and indeed an insightful discussion that we had here today. Thank you once again for taking the time to be with us today. We certainly look forward to having you again in our upcoming series. And our viewers, thank you for watching, and we hope you'll tune in again to our next interview series and join us in another discussion on low vision and similar topics. Have a good day, everyone.
Thank you.